To treat the mind as a separate entity from the body is a modern error. For centuries, our understanding of human pathology was shackled to the Greek humeral theory, the idea that mental distress was merely an imbalance of blood, phlegm, or bile. If you were depressed in the 9th century, standard practice was bloodletting or purging. It was a mechanical failure of the body that they thought explained the state of the soul. Abu Zayd al-Balkhi broke this. In Masalih al-Abdan wa al-Anfus, Sustenance for the body and soul, he argued that the soul and body are a unified ecosystem. If the soul is distressed, the body withers. If the body is ignored, the mind becomes a prisoner. While his contemporaries were busy balancing bodily fluids, al-Balkhi was practicing what we now identify as the foundational elements of cognitive behavioral therapy, CBT. Al-Balkhi's brilliance was not just in observation, but in the codification of Tadridge, gradual change. He understood that cognition is not static. He utilized internal speech to dismantle irrational loops, what he called al-waswasa, obsessive whisperings. His method was not to suppress the thought, but to use diversion, forcing the mind into rigorous intellectual or physical activity to starve the negative loop of its bandwidth. This is identical to the modern cognitive reappraisal techniques used to treat OCD and depression today. Al-Balki's framework was not a departure from his faith, it was the clinical application of it. He drew directly from the Quranic command of tazkiyah al-Nafs, purification of the soul. Indeed, Allah will not change the condition of a people until they change what is in themselves. Quran 13:11. Al-Balkhi interpreted this not as a passive blessing, but as a psychological requirement. You cannot expect your external environment or your emotional state to shift if your internal cognitive architecture remains stagnant. When the Bedouin asked the Prophet whether he should tie his camel or rely on Allah, the response was definitive: tie her, then rely upon Allah. Sunan al-Tirmidhi 2517. This is the ultimate psychological protocol. You do not leave the camel of your mind untied, you do not let your thoughts wander into chaos, and then claim trust as an excuse for inaction. You apply the technique, you do the work. Only then do you accept the outcome. The late Dr. Malik Badri, the father of modern Islamic psychology, was the primary scholar to forcefully reintroduce al-Balkhi to the modern scientific community. He demonstrated that al-Balkhi's classification of depression, distinguishing between reactive depression, external trigger, and endogenous depression, internal biological state, preceded modern psychiatric diagnostic manuals by nearly a millennium. Modern science has validated this through the lens of neuroplasticity. We now know that striving, the cognitive effort to redirect thought, physically alters the neural pathways in the prefrontal cortex. This is not mystical. It is biological. When you exert the discipline to reject rumination, you are physically remapping your brain's architecture. If you look at how modern science approaches human cognitive behavior, it focuses on behavioral activation, getting the patient to move, to act, to engage, to break the cycle of depression. This is simply al-Balki's diversion with a different name. The Quranic view is that the human being is in a state of constant mujahada, struggle, Quran 53-39, and that man will have nothing except what he strives for. This is the hard, cold reality of existence. Your mental health, your cognitive stability, and your spiritual clarity are not things that happen to you. They are things you build through the daily, disciplined, and often exhausting act of tying the camel. If you are suffering from intrusive thoughts or deep stagnation, the clinical remedy is the same as the spiritual one. Stop analyzing the darkness and start the work of replacing it. That is the synthesis of faith and science. That is the sustenance of the soul.